Welcome to Strike Stroke. My name is Dr. Mekdis. I love to learn neurology and teach you what I know, more specifically in regards to stroke. Today, I would like to talk to you about aphasia. So, our brain has two hemispheres, the left and the right hemisphere. One of them is termed the dominant hemisphere, and the other one is termed non-dominant hemisphere. The dominant hemisphere controls language and logical skills, where the non-dominant hemisphere controls art, imagination, gives us 3D spatial orientation. The dominant hemisphere controls the dominant hand. So if you're right hand dominant, that means your dominant brain is the left hemisphere. Those who are left-handed or those who are special and use both hands equally could have the dominant hemisphere be on the right side, or it can mean that their dominant hemisphere can also be on the left side. But 90% right-handed people will have the left hemisphere being the dominant hemisphere. Individuals who have suffered injury to the dominant hemisphere will have weakness affecting the opposite part of the body and will also have difficulty with language. This is called aphasia. Aphasia is complex. Individuals who have aphasia could have difficulty in speaking, understanding, writing, reading, grammatical errors, or difficulty pronouncing, difficulty with prosody. So what causes aphasia? There's several things that can cause aphasia. Aphasia can be caused quickly in the setting of stroke or head trauma, such as motor vehicle accident or gunshot wound. It can also occur somewhat slowly, between weeks or months, in a situation where there's a brain occupying lesion or lesions that don't belong in the brain beside brain tissue. These are infection, tumor, which are pressing on the language center, causing aphasia, which slowly develops. Or it can happen chronically over years in the setting of neurodegenerative disease such as Alzheimer's or primary progressive aphasia. So let's focus on the two common types of aphasia. They're called Broca's aphasia and Wernicke's aphasia. As we talked about, these are located in the dominant hemisphere, for most individuals being the left hemisphere. Broca's is located in the frontal lobe because it helps in production of speech, and the frontal lobe is involved in motor, so it makes sense that it's located there. Wernicke's area is located in the temporal lobe, close to the main auditory center. It also makes sense why it's located there, because Wernicke allows us to understand language. So we first have to hear it, then understand it, then we send it to the Broca's area where we produce it in a motor action. When an individual has damage to the Broca's area, they have difficulty in expressing word. It is a motor aphasia. They have difficulty in forming sentences, and their words will be broken into pieces, and this is called affluent aphasia for that reason. These individuals do not have difficulty understanding what is being said to them, but they have difficulty finding the right words to put together to express themselves. We also call this expressive aphasia because the individuals are aware of their difficulty or their effortful speech. They're very frustrated during communication. In contrast, when an individual has damage to the Wernicke area, they have difficulty understanding what is being said to them, but they have no difficulty in producing words. As a matter of fact, they're very fluent and they will say things that doesn't make sense most of the time. When you ask them a question, they will go on and make sentences. They will substitute a letter within a word. They will substitute a word within a sentence. Sometimes they will even produce a new word. They're unaware of their mistakes. And because of their fluency, we call this fluent aphasia. In between the Broca's area and Wernicke's area, there are these white matter tracts called arcuate fasciculus. These areas connect these two centers. So for example, when you hear something, you understand it in the Wernicke's area, then you send it to the Broca's area, and you're using this arcuate fasciculus to produce the language that is needed in communication. When you have damage to this area, it's called conduction aphasia because you have lack of conducting or organizing the information that you received and you're trying to put out. Individuals with conduction aphasia have difficulty in repetition. They will understand language, they will produce language. When you ask them to repeat a sentence like, "Today's a good day," they will not be able to do that. When all the centers are involved, both Wernicke and Broca's area, this is called global aphasia. The person who suffers global aphasia will have few words that they use, or they may repeat the same word for every question they're asked, and their language is very limited. They have poor understanding, poor speech production. We call this global aphasia, to almost being mute. Most of the time, individuals who have aphasia, if it's happening slowly or if it's happening fast, its stroke is noticed by a caregiver, family members, or co-workers, and they're brought to the hospital for evaluation. So when we're brought to the hospital or to the doctor's office, they may be sent to have a CAT scan or a MR of the brain. This allows to localize where the lesion is, but on physical examination, we're able to tease out the specific type of aphasia these individuals have, and this is about asking the person to repeat after us, to follow our instructions, to give us information, to identify objects, and etc. Once the individual has suffered damage to the language center, the way we repair that is through aggressive speech therapy. This allows the brain to recover itself, as well as have some form of neuroplasticity, which means making new connection to the surrounding neurons that are not damaged. As you know, young kids have higher or faster neuroplasticity compared to an older individual. So when you have the injury, the type of injury, the extensive of the injury really depends how much individuals will recover from the type of damage they have to the language center. Thank you for watching. I hope you found this information useful. In the next episode, we'll talk about neglect. And always remember to dial 911 if you or someone near you suddenly can't see, can't speak, can't walk, or can't feel. Let the operator know that you or someone near you might be having a stroke, so that you or the individual near you can be transported to the nearby comprehensive or primary stroke center for rapid stroke analysis and tailored treatment.